I would like to ask permission to share our slides, please. So, to
Go
the
ahead.
honorable members of the Senate Committee on Health, to our chair, Honorable Christopher Bongo, to Honorable Senator Amy Marcos, to our Honorable Secretary Francisco Duque III, and the DOH family, to the distinguished members of the House of Representatives, to our distinguished guests and participants, a pleasant good morning to you all. Next slide, please. So I, the Director General of PITAHC, Dr. Annabel Pabiona de Guzman, is here to give our manifestation on Senate Bill 1308, sponsored by the Honorable Emmanuel Manny Pacquiao, and Senate Bill number 2127, sponsored by the Honorable Ramon Bong Revilla Jr. So the Philippine Institute of Traditional and Alternative Healthcare, or PITAHC, supports the Senate bills amending for the purpose Republic Act number 8423, Traditional and Alternative Medicine Act of 1997, previously authored by our good Senator Juan Clavier. The bill aims to regulate the traditional and complementary medicine practices, practitioners, and products in the Philippines. These measures also include the strengthening of PITAHC with necessary regulatory powers to curb unscrupulous and fraudulent traditional and complementary medicine practitioners and facilities. So the Philippine Institute of Traditional and Alternative Healthcare is a government-owned and controlled corporation attached to the Department of Health and was created under Republic Act number 8423, otherwise known as the Traditional and Alternative Medicine Act of 1997. It is primarily envisioned to help improve the quality and delivery of healthcare services to the Filipino people through the development of traditional and alternative healthcare and its integration into the national healthcare delivery system. There are three major outputs for which the DBM allots its budget for PITAHC, and they are as follows: research and development, the technical advisory and advocacy services, the regulation of traditional and alternative medicine practice. And these are the traditional and complementary medicine modalities certified and accredited by PITAHC. There are 8 listed here, but there are still 2 being reviewed by the committees on accreditation, Ayurveda, and anthroposophic medicine. So first, we have the accredited modality of acupuncture, here being represented by Dr. Francis Gomez, chiropractic medicine, Ilot, here being represented by Dr. Isidro Sia, former Director General. We have osteopathy, Quina massage, naturopathy, traditional Chinese medicine, and homeopathy or homotoxicology. The RA 8423 amendments incorporated in both Senate Bill 1308 and Senate Bill 2127 gives PITAHC regulatory powers over the practice, the practitioners, and the products of traditional and complementary healthcare. But why is there a need for regulatory powers for PITAHC? Of course, it will enable PITAHC to have exclusive authority of all traditional and complementary medicine-related practice, practitioners, and the products. We also need regulatory powers for PITAHC because proper regulation is essential to the provision of quality, safe, and effective traditional and complementary medicine products and services. Here on our slides, we can see licensing and monitoring of the staff of PITAHC. So what is the relevance of the bill to the Filipino people? It provides the general public protection from the fly-by-night and unregistered practitioners who might otherwise provide more harm than good. We have 2,691 practitioners listed in 4 pilot provinces in a PITAHC Commission profiling study done by the Macro Health Research. while only 1,479 practitioners are registered nationwide under PITAHC. Thus, there is a big disparity between the two statistics presented, which implies that a lot of the unregistered practitioners may not have come up with the knowledge and skills required by the competency standards and guidelines for the accredited modality. Thus, this poses a big risk to our community. So another relevance of the bill to the Filipino people is that the proposed bill provides the Filipino people better health options with a wider range of quality, safe, effective, and cost-efficient traditional and complementary medicine, health products, and services. The Senate Bill number 1308 specifically provides for the regulation of traditional and complementary medicine practices and practitioners, whereas Senate Bill number 2127 is the regulation of the traditional and complementary medicine practices, practitioners, and the products. But why products? Inasmuch as in the practice of traditional and complementary medicine, products cannot be separated from the practitioner and his practice, such as the use of herbal medicines for hilot, naturopathy, traditional Chinese medicine, and the use of homeopathic medicines for homeopathy and homotoxicology. The use of TNC and products of practitioners may also have adverse reactions with conventional medications. Thus, the need for effective and professional guidance and for government to regulate. If given budget appropriations for the setup of a laboratory for proper identification of herbs, bioassay and test for heavy metals with the necessary manpower, equipment, and capability building services, Senate Bill number 2127 would give more advantage to PITAHC since it covers the practitioner, the practice, and the products. Therefore, the Philippine Institute of Traditional and Alternative Healthcare interposes no objection to the proposed measures of Senate Bill 1308 and Senate Bill 2127. Philippine Institute of Traditional and Alternative Healthcare offers options for better healthcare in the Philippines. Thank you very much and good morning, Honorable Senator Bongo and our audience.
Thank you, Dr. Annabel de Guzman.